per day. That was per day. Every day, people confirmed with corona were 1,735 at that time, to an average of a new law now of 71 per day. Therefore, today, when people go to check, you find only 71 have corona instead of 1,735 per day. A consistent drop in positivity rate from the highest of 22% to an average of 8% today. Before we intervene, when you will test 100 people, 22 will be having corona. But now, when we test 100 people, you find that only 8 have corona. A fall in the daily admissions of the severe and critically ill patients from 204 at the peak to less than 50 per day to today. The hospital admissions, that was also another big problem. People who are sick who go into hospital, there were too many. At that time, 204 would be seeking admission in one day. But today, 50 are the ones who want to go into the hospital, who are critically ill. There has also been a reduction in daily death. However, the drop in the daily number of deaths remains slow due to late presentation to the hospitals. This is the biggest problem. People, when this crisis started, on the 18th of March, I was on this TV, and I really told you everything the doctors had told me. And one of them was, as soon as you hear symptoms like flu, like Senyiga, even when you don't feel well, you feel like fever, you think it may be malaria, go and check corona. That's what we told you. But some people, even here in State House, I have had to take disciplinary action against staff here. They hide. Somebody is having, saying he's hiding, denying. They must be able to insist, why are you, and when they check them a number of times, they have corona. Now, that's where the problem is. Because this disease apparently is very dangerous. It attacks the lungs, and you know the lungs are the only ventilation the body has. Now, when you delay, the lungs get damaged seriously. I hear even the kidneys. That's what I hear. So when you delay, even when the corona is defeated, like one of our children who died recently, the son of Professor Kamuntu, a young boy, 45 years old, very brilliant. He was a senior man in the bank. Professor Kamuntu told me that because of delay, the boy went to hospital. Corona was already healed, but the damage to the organs was irreversible. So this delaying to report is a very, very serious mistake. and it is the main cause of death. Corona will go, but the damage to the organs is already irreversible. I would like to appreciate the population for adhering to my directives during this lockdown, which has resulted in the above-mentioned achievements. As of 29th July 2021, the country had registered 93,927 cumulative confirmed cases of COVID-19, 83,115 recoveries. So out of 93,000, 83,000 have recovered. And 2,690 deaths. This 2,690 deaths, this is recent. Because by April, I think we had lost only 200 and something people. By April, after a whole year. But because false prophets, Banabi Abobulimba, they come and say, what the government is doing is nonsense. You go. They are stopping you because they don't want you to have rallies. Because you will have huge rallies if they don't stop you. Who can have bigger rallies than NRM? I have never seen any myself. Normally when we have rallies at Kororo, we have 1 million people. So when we were saying please don't meet, it was not that we didn't want opposition to have rallies. It was we didn't want our people to die. So you can imagine now, because by April there were no patients in the hospitals. I think March there. I know this because there is a drug we are trying, one of our indigenous drugs which we are trying. We needed patients, and there were no patients. In March, in April, I would ring Museveni there. Well, how far have you gone? So we don't have patients. Because we wanted 124 patients to try our drug in them. But we didn't get these patients. When I was checking around March, they were telling me we have only got 21. Because people were not getting sick. Very few people were getting sick. But because of the mistake of the false prophets, Banabi Abobulimba, coming to May, there was an explosion. So that's how we lost these all these more than 2,000 are because of the mistakes of the false prophets. Banabi Abobulimba. Otherwise, by March, I think the dead people were only like 200 and something, 60 something. Currently, there are 626 patients admitted in various hospitals. A total of 597 are in public health facilities and 29 in private health facilities. Because now we have got about 4,000 beds. We have now got 4,000 corona beds. I had told these people to target to a higher figure, but they delayed with money, procurement. But we have now 4,000 and we are moving. I think the target is like 20,000. Therefore, when we have 626 patients, it means we are using only 1/4 of the beds of the capacity we have now. Only 1/4. Chimuchakuna. But by the time we declared lockdown, all these beds were full. All these 4,000 beds were full and people were overflowing. But now we're here, only 1/4 are used now. Three quarters are just idle. So it shows you that and because the government hospitals were full, that's how people went to private hospitals, and the private people were overcharging them. It all started with the false prophets. So now the people who are in the private hospitals are only 29. 626 are all in government, 597 are all in government hospitals. Of all the confirmed cases, 53,000, representing 56% of all Ugandans that have ever got corona, have happened in this second wave from the month of April 2021 to today. Down there, you will see the graph of the first wave and the second wave. But take a recall, put that graph there. Now you see how the first one climbed up around December and then came down and then was very low. You can see between the two hills, that flat ground, very, very few cases. Then it went up. Now it has come down dramatically. Now coming to the corona, put that map. You can see the corona there now. The blue ones are the clean, the blue districts are the clean districts. The ones without corona. The white ones are the ones with the 1 to 20. Then the dark, the light brown, that is 2150. The red, 51,200. The purple, more than 200. So you can see the purple are the purple, that must be our dear Kampala. And then the other one on the border, is it Rakai or Chotera? And then the other one up there, is it Amuru or something? Oyam? Maybe Gulu. And then the one near the border, would that be Tororo? So the districts with the highest amount of corona people are there. Now, in the last 2 weeks, it is only Kampala that had 200. Is it per day? The 200 per day. Only Kampala was still high. Now, some of these figures are for Kampala. For Kampala, daily, in June, there were 9,852. June up to 13th. Then up to 14th and 20th, there were 8,000. Are these for Kampala only or for all? These are for all. Then 6,033 in June. Then 28th June, 4th July, 5,120. Then 5 to 11 July, 3,640. And now 1,885 in the whole country. The average positivity rate has been coming down, as I said, from 22, from 18 out of every 100 to now 8 out of every 100. And the average admissions are also going down. In June, it was 149 per day. People who are coming to the hospital being admitted. It is now 47. The previous and the current lockdown are part of the preventive health interventions to contain the outbreak in order to protect lives and reduce death. This is in addition to the government strategy of mass vaccination. The government is using a multi-pronged approach to secure adequate vaccines for the target population of 22 million. Those are people who are 18 years and above. Scientists have informed me that children above 12 to 18 years can also be vaccinated using the Pfizer vaccine. I've directed the Minister of Health to include this age group in their estimates and plan holistically. The following options are being used to access vaccines from the global market. Number one, purchase of vaccines through the COVAX facility. COVAX is like a shared arrangement globally. Purchase of vaccines through the African Union. Purchase of vaccines from manufacturers. Donations through the COVAX facility. An order of 2 million doses of the Johnson & Johnson vaccines have been made with the African Union, and a down payment of $3 million has been effected, has been implemented. Delivery will begin in August 2021, which is a few days from now. because today is 29th, 30th. So August is the day after tomorrow. I've been informed that tonight, 30th July 2021, we are receiving donations of 286,000 doses of AstraZeneca vaccine from Norway, I would like to thank both governments of Norway and the People's Republic of China. We are expecting 647,000 doses of the Pfizer vaccine from the USA, 688,000 of the AstraZeneca vaccine from the COVAX facility, and 299,000 doses from the United Kingdom. This gives a total of 1.6 million doses of vaccines, which cater for 17,000 people. Although these are our donations, I have directed the Minister of Health and Finance to urgently secure vaccines for Ugandans by paying, not just depending on donations. Vaccine manufacturing capacity. To date, 3 candidate vaccines are at different stages of trial. Whereas this may take us some time, this is an effort in the right direction. This is an endeavor that the country will pursue to disentangle itself from dependency. As of today, a total of 1.1 million doses of the AstraZeneca vaccine have been administered to the population countrywide. 903,000 people have received the first dose, while 233,000 have received the second dose. During this second wave, I was informed of the challenge faced by the COVID-19 treatment facilities due to inadequate medical oxygen. But before I go into the oxygen, I should inform the Ugandans that we are now talking of the second wave. Other countries are already in the 4th wave. So we are now talking of second wave because we were careful. We had succeeded. And we could have avoided the second wave completely. Yeah. You saw that graph where it was flat from December last year. Very, very few cases. So if people had listened, we would not have gone for the second wave. Other countries are now already in wave number 4. For us, because of the false prophets, in spite of all our efforts, we are now in wave 2. So please, let's work to avoid the 3rd wave now. On the issue of oxygen, the government is enhancing the existing oxygen production and supply at the national and regional referral hospitals in Uganda to cater for both the COVID-19 cases and other essential medical services. The procurement of gaseous oxygen plants, pressure swing adsorption is ongoing, and this will be installed in all the 15 regional referral hospitals and Bombo Military Hospital. In addition, a similar oxygen plant with a bigger capacity will be installed at Mulago Hospital. Furthermore, 3 cryogenic liquid oxygen plants will be procured and installed strategically in 3 regions of the country to complement the gaseous oxygen production. The Minister of Finance has already provided funding for this. This will solve the current oxygen crisis. When I was discussing with our team, we were targeting oxygen capacity of 24,000 cylinders per day. Was it 24,000 or 18,000? So these machines, the 16 in the referral hospitals and the 3 cryogenic, the one cryogenic is the one of liquid oxygen, which will be in 3 sites, each one producing what? 5,000? Each one. So that issue of oxygen will be solved. On the 18th of June 2021, when I instituted the lockdown, I directed the Prime Minister and the Minister of Gender, Labour and Social Development to define and identify persons who depend on daily income in cities and municipalities who were affected by the lockdown, assess their needs during the lockdown period, and suggest interventions to take care of their needs. From our experience with food distribution in the lockdown of 2020, Cabinet decided that each of the selected 500,000 vulnerable persons in Kampala, the 10 cities, and 31 municipalities should be given Uganda shillings 100,000 so that they can buy food of their choice. The category of people identified included the following: bus, taxi drivers and conductors, because these buses were not working, and the taxis. Baggage carriers, wheelbarrow pushers, touts, traffic guides, and loaders in taxi, bus parks, and stages, and other major commercial centers such as Chikubo. Barmen, DJs, I don't know who DJs are, waiters, barmaids, bouncers, bar, gym, and restaurant workers, food vendors in bus, taxi parks, and arcades, artists, musicians, and comedians, border riders, special hire drivers, and Uber drivers, saloons, massage parlor workers, teachers and support staff in private schools and teachers in government schools not on the government payroll, car washers, slum dwellers, ghetto residents, street and food vendors, shoe shiners, and cobblers. The beneficiaries were selected from administrative records held by the urban authorities and town clerks. That's why you should register yourself. Because when we were looking for people to give support, we said, but people, if you say you have been doing business, that business is registered. And when it is registered, it can be got from the company. So there's no question of saying, I am working, but I'm not registered. Why are you not registered? Why is your company not registered? Why is your business not registered? So you can see now the advantage. If you are registered, you'd have no problem. The beneficiaries were selected from administrative records held by the urban authorities and town clerks. I've been informed that as of Friday, 30th July 2021, 500,945 beneficiaries out of the target of 500,001 had been uploaded on the online registration system. Uploaded means what? That they were they were identified and recorded. Oh, okay. So these ones had been identified and confirmed. Then a total of 462,000, 92.3% beneficiaries had been verified and paid by Post Bank as of today. This totaled Uganda shillings 47 billion. The balance of 38,000 persons has been deferred for various reasons which are still under review by the town clerks before resubmission for payment. I'm told that the online system which we have used to register beneficiaries and submit their details to Post Bank for payment was designed by the Bazukuru, who are information technology experts at the National Information Technology Authority, NITAU, and the Ministry of Gender, Labour and Social Development. I have further been informed that if private consultants had been procured, the development of this system would have cost the government at least Uganda shillings 500 million. I therefore would like to thank this Bazukuru for being patriotic and saving public funds. Local therapeutics, local edagala, eryokuwonya. Kubanga biri bitwogeddeko byakugema okutangira oyo kaweefube gyali tumuteddemu amaanyi naye ate waliwo n'okuwonya. Our own scientists are working around the clock to find solutions to the attack of the coronavirus. They are at different levels of development of treatment remedies using all natural products. I'm aware that several Ugandan teams have now discovered natural extracts that could have therapeutic benefits against corona-19. I'm thus working with many Ugandan scientists to ensure we follow the international standards and guidelines to avoid being labeled inferior and thereby sabotaged by international players. The molecules referred to here act in a similar manner like all the drugs that have been recommended by the WHO organization. For example, the one by Dr. Nambatia and other people. Nambatia was not alone. Nambatia was working with other people. Katenta Pudi. There is a Mtoro boy. I've forgotten his name. This one is known as UBV10N. Has more and self-destruction. The one by Professor Patrick Ogwang of Mbara University called Covidex, and Dr. Alice Lamwaka from Guru University, Covidex 1, have direct effects on the virus, as well as dampening self-destruction effects of the virus, the panic crisis. Therefore, a few Ugandans and other international skeptics shouldn't undermine our homegrown scientific efforts by telling lies about our efforts. Also, the scientists involved must follow the globally prescribed steps so that we don't give our enemies the chance to shoot down our products. Last and more importantly, we must protect the intellectual property rights of the scientists involved. I have heard of arguments around ownership of the patents and trademarks, but this is a straightforward issue. These belong to the scientists who discovered them. If the institution that employed these scientists want to benefit from their innovation, they should levy a sort of tax that the technology transfer experts refer to as sharing of royalties. Even then, much of the proceeds should go to the inventor so that we encourage our scientists to discover more. The Ministers of Health and Local Government, the Ministers of Health and Local Government developed a community engagement strategy, community surveillance, and home-based care guidelines and disseminated these to all districts and reoriented all the district local governments. During the lockdown, I'm informed that the following were undertaken. The district task forces were oriented to coordinate and supervise home-based care. The VHT's community health workers were trained on community-based disease surveillance and home-based care. The district task forces assigned one district home-based care coordinator and one village health team member to provide feedback and updates on the community engagement interventions through the established structures from parish level to the district. A mechanism for collecting information on the positive cases under home care from the communities through the health facilities was established and is functional. Because, you see, this disease is really not a serious disease if people are serious. You have heard that we have had 81,000 recoveries. And really, although I was watching the TV before I came here, that this Delta something variant is more effective than the other one. But otherwise, 2 meters